This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. This is Mon Health Talk. Our guest this morning is Dr. Randall Hofius, robotic surgeon and general surgery at Mon Health. Good morning, Dr. Hofius.
Good morning.
Appreciate you coming on. We're going to talk about robotics, Preston Robotics this morning. We'll get into the topic in just a bit. But first, as we do each and every week, you've probably been forewarned you have to talk about you for at least a couple of minutes here. So,
okay.
With that said, let's just give us your background a little bit. Hey, where you're from, where'd you go to school, and how you ended up with Mon Health.
Okay. What I consider my home is the Newcastle Hermitage Sharon area in Pennsylvania. Pretty much lived there all my life. Went to undergrad at both Gannon and at University of Pittsburgh. Went to medical school in Missouri at Kirksville College of Osteopathic Medicine. I did my internship at Warren General Hospital in Warren, Ohio. Then my residency at Community General Hospital, which is now Pinnacle, down in Harrisburg. Worked several different hospitals in and around the Youngstown, Sharon region, Newcastle region over the years, and was presented with an opportunity down here in West Virginia at Mon Health. Specifically, they were looking to start up a robotics program at Preston Memorial Hospital and was really excited about it, so I made the transition down here.
So what drew you to surgery and then in particular getting into the robotic surgery?
Surgery in general was back when I was in medical school. We had numerous classes, ophthalmology, cardiology, rheumatology, nephrology, and, of course, surgery. And for some reason, general surgery, from the didactic standpoint, just really caught my interest. And I knew back in medical school, before I ever did any clinical rotations, that I wanted to be a general surgeon. And certainly once I got doing the clinical rotations in medical school, I knew that was the right choice for me.
General surgery, obviously from the outside looking in, it seems like it would be extremely challenging as you come up with a plan, you go in and things may not go according to the plan. But with it being so challenging, it seems like it would be extremely gratifying as well.
It is gratifying, and I'm not sure I would use challenging. I would use, I guess that is a word, but what I find more appropriate is interesting, because you just never know what you're going to get. Every patient is different. Every disease process is different. Every disease process presents differently for the most part in different patients. So interesting and challenging. Maybe not so much from the surgical standpoint or the actual physical surgery standpoint, but the intellectual standpoint, often it can be.
I think you're using the word interesting, and then I'm using the word challenging. I think we were both driving in the same direction there. Although, again, not being a surgeon, I would find it all very challenging to be able to go. Actually, I had this conversation with one of my cousins who does ear, nose, and throat. I was kind of joking with him. He posts pictures all the time of the insides of people's nasal cavity, Doc. And he says, and I laughed. I said, I find it very interesting. I have no idea what I'm looking at, but I love looking at your Instagram account. So I digress. Yep. I digress. Where do you practice?
I'm at have an office here in Morgantown at Suncrest, and obviously practice at Mon Health, and also at Preston. And my office in Preston is right in the hospital itself.
All right, and we're going to talk more about what's offered at Preston Memorial Hospital. But first, we're going to go ahead and squeeze in our first break right here. Then we'll jump into that coming up in just a couple of minutes. Dr. Randall Hofius joining us this morning, robotic surgeon, general surgeon. We'll talk more to him right after this as Mon Health continues. Mon Health Talk continues on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Randall Hofius, robotic surgeon, general surgeon with Mon Health, and we're going to get into what the offerings are in robotic surgery that's offered over at Preston Memorial Hospital. So, Dr. Hofius, what kind of robotic surgeries are offered over in Kingwood?
Well, anything that's done laparoscopic, minimally invasive surgery, can be done robotically. Specifically, as far as what I offer are hernia repairs, gallbladder surgery, and colon resections. Now, there's some other little procedures, or I don't know how little they are, like colostomies and that kind of thing that I also perform robotically. Sometimes I do appendixes robotically, particularly if it's a ruptured appendix. Now, from a gynecological standpoint, hysterectomies and removal of ovaries can be done robotically. From urology standpoint, it's just the sky's the limit. Prostate surgery, kidney surgery, pretty exciting.
When we say robotic surgery, we don't mean that the robots have taken over the operating rooms, but
No.
you're able to use really advanced tools that really benefit the patient. Just so explain what we're talking about with robotic surgery and what's the benefit to the patient.
So it's definitely not a robot. Everything, all movements of the instruments are controlled by myself. The reason they call it a robot is that it has arms that we call docked to the ports, and the instruments go onto these arms, and it kind of looks like robotics, or like a robot, I should say, just the way it looks. But as far as the control of this is 100% by myself. The advantages are that with the robotics, you have what we call wristed movement. So if you take your wrist and you bend it forward and backwards and you kind of turn it around, it's the same motion that if I'm holding an instrument in my hand that I can obtain through the robotics. Gives you much more control, gives you really the ability to sew very effectively. And that doesn't seem like a big deal, but it's absolutely huge. As an example, when we do hernia repairs, we always use mesh, or most of the time we use mesh. In fact, pretty much always we use mesh. Now, you may have heard on some of the commercials from the lawyers talking about chronic pain from hernia repair. Chronic pain from hernia repair is not from the mesh. Chronic pain is from the traditional way of anchoring in the mesh, which was staples, tacks, or corkscrews that stayed around in the body forever. That's what caused chronic pain. With the robotics, we can easily sew in the mesh using an absorbable suture. It's gone in a couple of months, therefore no chronic pain. It's a huge advantage.
Talking to Dr. Randall Hofius this morning, robotic surgeon, general surgeon with Mon Health. What are some of the key differences, and you started to hit on them there, between using the robotic instruments and what we would consider traditional surgery?
Well, two types of traditional surgery would be open procedure, and there's still at times there's a call for that. If somebody has a very large bulky tumor, say a colon cancer, well, you do need to do an open procedure often. You have to make a big enough incision to get a big tumor out, and therefore you lose the advantage of the minimally invasive surgery done robotics, and also laparoscopic. The laparoscopic is kind of like operating with chopsticks. You can push the instrument in and out, and you can rotate it, but you don't have that wristed motion like you do with the robotics. The other thing is that when I'm looking at inside of the patient, it is 3D high def. It's just about like looking at it with the naked eye. And can be magnified as well. So you can really do a very nice dissection and find those tissue planes very easily, much more easily robotically than you can laparoscopic. And that means that the surgery goes along easier, the specimen comes out easier, and less bleeding.
I know there's some folks probably listening right now, and they're thinking to themselves, this all sounds great, but I'm the patient. What's the bottom line, whether it's laparoscopic or you got to do traditional? What's the bottom line for the patient when it comes to the advantages of robotic and these minimally invasive procedures?
Typically less pain. That's the big deal. Return to normal function. In the case of doing colon operations, typically return to normal bowel function much quicker. Being that it's less invasive, we don't get the spasms in the intestines. We call that an ileus, I-L-E-U-S, ileus. We tend not to get that. It's just a complete game changer with inguinal hernias. Only maybe 40% of my patients ever use pain medication postoperatively, and as far as return to work, often people can go back in 2 or 3 days. They'll have a little bit of discomfort, but as far as doing any damage to the actual repair, there's none. That's probably the biggest thing, is return to normal function quicker.
Not to oversimplify, but it seems to me with a lot of the conversations I have on this program, the big overall goal is with any procedure or treatment is improve quality of life and return to normalcy as quickly and safely as possible. Is that a fair statement?
Oh, that's a perfect statement. Yes.
Dr. Randall Hofius is our guest this morning, robotic surgeon and general surgeon, and we will continue the conversation right after this quick break as Mon Health Talk continues on WAJR.
This is Mon Health Talk, providing a window into the Mon Health System and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Couple of more minutes with our guest this morning, Dr. Randall Hofius, general surgeon and robotic surgeon. And Dr. Hofius, Mon Health recently announced that they have implemented the Intuitive Hub at Mon Health Medical Center and Mon Health Preston Memorial Hospital. One, what is that? And how will that impact your work as a surgeon?
The Intuitive Hub, a very short answer, is that it is a way to videotape the operation that you're doing. I believe there's 5 cameras, if I'm not mistaken. So not only are you seeing the actual operation inside of the patient, but you're seeing how the nurses and the scrub techs flow. You're pretty much seeing the entire room. And the advantage of that, going back and reviewing these, is that you can more easily streamline an operation. Doing a case robotically as opposed to laparoscopic, there are some additional steps in order to get it set up, so it does add time onto a procedure. So if you can go back and view these, you can speed up the operation. And, maybe you're only knocking off 2 or 3 minutes, but, over the course of a year, that's pretty significant. The second thing that the hub does is that another surgeon can actually patch into it live while you're doing the operation. So at times it's nice to have a second pair of eyes on something. Usually those are more complex cases, such as an extremely bad gallbladder or a colon resection, but it gives you that opportunity to kind of get a bedside second opinion, and that video can be viewed, or the cameras can be viewed pretty much anywhere in the United States. They just have to plug in, and you have to grant access to them with it.
That fascinates me, that here you can be in Kingwood or Morgantown doing an operation, and you can have someone consulting, or you can have a second set of eyes. They may be across the country in real time and be able to, offer advice if needed, or just look at it from a different perspective. And ultimately, this is all to the benefit of the patient who like we said, you're trying to get them back to improve their quality of life, get them back to normal as quickly as possible. That is fascinating.
Absolutely. I don't know if it's necessarily be considered a game changer, but it's certainly another nice tool to add into your toolbox to make life easier.
Why should patients be aware of all of these different advancements in robotic surgery, the intuitive hub, just in general, procedures improving, techniques that get refined? Well, why should patients at least be aware of these advancements and have an idea of what's happening in your community, in your world?
Again, from the surgical standpoint, a big example would be a gallbladder, that it's just a safer operation because you can do so much better, dissection so much better robotically than you can laparoscopic. And then the return to normalcy, the return to normal function with less pain. And as we know, opioid crisis today is at least in part contributed to by doctors trying to keep patients out of pain. Well, if you never give them the pain to begin with, then you don't have to rely on narcotics to get them to feel comfortable. With a colon operation, it's we call it a cancer operation, and what that really signifies is how we can resect the colon out and the lymph nodes that we can get, how much of a complete resection we can get. And robotically is unbelievable as far as how precise we can be to do this operation. And it has not been reported at this point, but I think it's going to show in the future that you can do a better cancer operation doing it robotically than either open or laparoscopic.
Final question here, and I'll leave you about 30 seconds to try to answer it. It's a little loaded, but I hear about each week the advancements we have made in all of these procedures and all of these techniques over the last, say, 20 years. And it just makes me wonder, where will we be 20 years from now? Do you think about that, and where do you think this is all going?
I don't have an answer for that. I think probably they're going to be using some type of immunomarkers for cancers that when we're doing the operation, that we'll be able to somehow fluoresce the cancer and do even a more complete resection than we're doing today, than we're doing now. That would be my guess.
It'll be interesting to watch. Maybe it'll be challenging some point in the future as well. Hey, Dr. Randall Hofius, appreciate you taking your time this morning. Of course, you can get more information over at monhealth.com/surgery. Dr. Hofius, appreciate it. Thank you so much for the time today, and we'll talk again soon.
Do I have 20 seconds to say something?
More like 10, but go.
Okay. The community should be extremely appreciative of Mon Health for spending a huge amount of money to bring this technology to Preston County. Thank you very much.
You nailed it. Appreciate it. Thanks so much.